first session, we are talking about bridging the wellbeing gap, and I'm delighted to be joined in our studio by Sinead Proos, who is the head of wellbeing for Laya Healthcare. Joanne Healy is the head of group employee relations with Bank of Ireland. Dr. John Gallagher is founder and chief medical officer with Cognate Health, and Professor Na Fu is professor in HRM at Trinity College Dublin. You are all very welcome. Thank you so much for joining us. Sinead, we go again.
We go again.
This is our fourth rodeo?
It is our fourth rodeo. Together.
Together, absolutely. What I'm loving about the Workplace Wellbeing Index is we are seeing trends. Yeah. There's a huge amount of consistency, but then there are things that are changing because we have been through this incredible upheaval over the last few years.
And we've been just talking about that. The first one was behind the computer at home when I was told by my bosses at Laya Healthcare, make sure the twins are not on Wi-Fi. Because we were parenting from work. We started helping people about helping them understand how to parent, which is totally not normal. It's how can you parent and work? You can't do that, but we had to do it. And then we talked about the anxious norm. We were saying people are anxious. There's an anxiety that's bubbling up. But that's not normal, but we have to learn how to deal with it. This is the new world we live in. And then we talked about the illusion of flexibility. So today, we're here at 10 o'clock because people are telling us, I'm bringing my kids to work, okay? I want that flexibility. I want to be able to, men or women, it doesn't matter. That's their non-negotiable. That's the new world we live in. So if you're going to have an event at 9 o'clock in the morning, I'm not going to be there.
Yep.
So if you have it at 10, I'll be here. We have an amazing turnout now. So there's opportunities to change and you got to roll with that. You got to look at the data and say, this is a great opportunity. But you also have to look at health, stress, anxiety, and how they're different. And you need to know how to tackle those in the workplace. We're going to talk to a lot of those things today.
We're going to talk a lot about anxiety later on. The anxiety I have is when we were doing those workplace webinars and we were all on our home broadband and then the broadband would freeze and then you'd have that horrible face and everyone would wonder.
I was like this.
Yeah, it was a good look. Don't get me wrong. It was a good look for you.
Well, you were great because you kept the conversation. You kept the conversation
I filled the
going.
gap, which is all I'm good at. The key stats and trends from this particular report. So what have we learned in the last 12 months?
So 12 months ago, we had Owen talking about financial well-being for the first time ever when it came to mental health, because we didn't have the Ukraine crisis. We didn't have the rising cost of living. We didn't have interest rates going through the roof. And we didn't have a situation as HR leaders where people had less money in their pockets than they did the year before, even though they were getting pay increases. That was tough. That was a tough thing to manage. That's still there. We are going to talk about that. That's still there. That's becoming chronic. So that needs to be dealt with in whatever way you can deal with that. That intense anxiety is definitely coming through now. So people are able to talk about mental health better than ever. That's fantastic. But that's an umbrella for a lot of different things. Yeah. So being able to know what's going on, that's one thing.
Can I just, before we move off that, one word that stood out was intense. And, you know, we used to talk about anxiety, that his nerves are rattled, or you know, it used to be dismissed and put down as something. Sure, that's grand. He'd be fine next week. We'll give him a day off. Whereas now, you know, we're realizing that intense anxiety is not just the work pressure. It is the home place pressure. It's the financial pressure. It's, you know, worrying about wars in other countries. That intensity has increased a lot in the last 12 months.
I'd love John to come in on this because when we were talking about this last week, you were saying there's a difference between stress and anxiety.
Yeah, and just reflecting on the piece, the anxiety we all feel. I mean, we live, not only the work environment has probably changed, it's less stable in general, but our general environment where we all live has changed, let's face it, between wars and everything else and disruption. So everything's gone unstable. We're not used to that.
And now, from your experience as well, I suppose that it is starting to become a much bigger thing, this idea of anxiety. We'll talk more about it later, but have you noticed that big change?
For sure that, you know, because I'm from academic research perspective, that I can see more and more research going into well-being, ill-being, depression, mental health. Even currently we have, accepting papers for a special issue in the top journal. I'm one of the guest editor for that. You can see that the awareness, the attention to tackle the anxiety or depression or any other mental health related at the workplace is growing.
One of the other big challenges in the last 12 months as well has been talking about women's health, and we're going to talk about unlocking well-being for women as well. This is a conversation that is so long overdue, Sinead. What has prompted it? Why are we talking about this now? I mean, it's not as if these are new problems for women, but it's as if all of a sudden workplaces have realised, actually, we have a role to play here.
Yeah, and I think Joanne is going to talk about, we see so much coming through around senior leadership. The fastest growing demographic in the workplace are perimenopausal and menopausal women. Fact. And when you get to this stage, I'm in that group now, and when you get to that stage, you do get symptoms and you go, Christ, is it worth the stress?
Yeah.
You know, because you're in a position that commands a lot of your attention. You're also a mom, you're also a wife, as my husband keeps on reminding me, who you met last week, and you have a household to run. And it's not that I do everything. I have an amazing support network, but you're kind of juggling all those balls, and you just can't keep them all up. And the workplace is starting to realize we can't let those people go. You know, there's 43% of women in the workplace who are symptomatic of perimenopause and menopause, and 10% of them are going to leave because they say it's not worth it.
First of all, when I met your husband, he said lovely things about you. Put that on the record. And second of all, there were many, like over the years, you know, the various different barriers to women succeeding in the workplace. We focused primarily on if you had to take time out for maternity leave, that somehow would injure your career prospects. It's as if we wrote people off over the age of 45, that, oh, she's gone, is she? Oh, what happened there? Who knows? Now we're starting to address what the actual issue is. So, and we'll talk more later on about the resources that can be put in place. But it's good we're having this conversation, isn't it?
Fantastic.
It's
really
interesting
fantastic.
because you mentioned data and what we're seeing. So if you consider there's more females, there's more males than females in the workforce, but we see more females referred to us than males. It's about 60-40, that's the way. So you say, why is that? And you look at, okay, what's coming through in terms of the problems presented to us. It's mostly mental health issues. That's the reality. So we see 40% plus mental health problems. And again, females are the majority of those referrals. But the only place where the males have the greater numbers of referrals are cardiac and road traffic accidents. They're the only two.
Road traffic accidents.
Yeah, the only two. So
That's sure what that says about our driving.
Indeed.
Is that being on a mobile phone?
Yeah.
or whether they're related, but it's mostly females, and when it comes to mental health, it's exactly the same. And when you get down, so of the mental health problems you see, it's mostly anxiety, depression, about 2/3, and it's about 1/3 stress. Okay, and of the stress, most of it is occupational and some non-occupational. When you get to non-occupational stress, it's mostly females. Very few males. Okay.
And we'll come back to that a little bit later on. But just before we move on, Sinead, the other issue, one of the statistics that stood out for me about 2 years ago was 2% of people during lockdown were working from their bed. And I just couldn't get my head around this at all. Now we're more, hopefully they're out of the bed now. But
No.
probably not in some cases. But connecting lone workers, that's become another big challenge, hasn't it?
Yeah, and again, I go back to occupational health because we do a lot of, Cognate Health, as our strategic occupational health partner, do a lot of risk assessments for us within organisations. And that is kind of maybe bog standard in pharmaceutical, manufacturing plants, where you want to make sure the environment isn't negatively impacting on your health. Could be your hearing if you're in a loud manufacturing environment, could be exposure to chemicals. That's a very traditional that's your physical health. And what we've seen is because there's so many people choosing remote working, which is good, right? It's a completely different type of leadership when it comes to duty of care. So you're risk assessing somebody who is in effect a lone worker. They're not, we're here now today, there's a great buzz, we're all together. That's very important in terms of your health in a workplace.
And that's what we lost when we were all working from home. We missed that opportunity, the water cooler moments, those little moments of inspiration, particularly for younger workers coming through.
100%.
The opportunity of meeting the boss in the lift. If I hadn't met a few bosses in the lifts over the years, I wouldn't have gotten very far in my career, I can tell you.
And there's great value in that for collaboration.
They were trying to get out of the lift as soon as they met me.
Not maybe the water cooler bit, but it's just on that point, you now have somebody who's coming into an organisation, but their exposure to that organisation is sitting in their home behind a computer.
Yeah.
So that needs to be managed differently.
Yeah.
And that's the connection of the lone worker.
Now, let you come in there.
Yeah, that's a really good point because if you think about the knowledge transfer, in an organization, where if you do not have the face-to-face time, a lot of a tacit knowledge, kind of cannot be passed on to the newcomers. And even I think that, we talk about the gender, I know that we will come back to that one. But if you think about that, going to the office, I think that females workers would not have the same opportunity to go to the office. If a company requires 2 days a week, and then I think, or 3 days a week, I know a company using hybrid mode, but is it really fit for purpose for female?
Yeah. It's a very important point. Now, one of the things that has come out in the findings of this report, 70% of employees feel supported by their employer to take time to look after their mental health. I think that is a significant change. It's an increase of 10% in the last 12 months alone. Joanne, those supports are vitally important, aren't they? Because if somebody has the bravery to put their hand up, they need to be heard, don't they?
Absolutely, and I think it's really encouraging to see that in the report, and I think it really demonstrates how far we've come in this area. Absolutely, it wasn't that long ago where employers were expecting you to kind of leave your personal issues at the door and come in, which is obviously, we know now, is unhealthy, unproductive, and actually impractical, And I think from there we kind of went to a bit of maybe low value lip service, kind of maybe we have a wellbeing budget and, we'll throw a pizza party once a year and we'll buy a ping pong table and everyone will be well, Nah loves the pepperoni pizza. But that's obviously not going to be anyway significant.
It's tokenism, isn't it? And
Absolutely.
the worst thing you can do is provide tokenism.
It is, because it completely undermines your credibility as an actual supportive employer. So I think now we've come on leaps and bounds, and I think we've seen that employers really do listen to their employees a lot more, understand how to have more bespoke and actual practical supports in place. Like, I think in COVID at Bank of Ireland, like everybody else, we had to completely pivot and say, right, what do our employees need from us? Whether they were shielding, whether they had caring responsibilities, twins popping up at home in different meetings, what do they need from us? And it was a whole new world. And I think coming out of that now, as you say, we're faced with geopolitical instability, we've got the major cost of living challenges, which are really causing a lot of uncertainty and pressure on people.
But the results that can come from, good practice, they can actually result in better performance, can't they? Because the people who benefit from that listening ear, that understanding, instead of, shrinking, they can actually grow a little more, can't they?
Absolutely. It means that people can come to work, actually feel like they're being listened to, they're being supported, they feel more motivated and ultimately more productive and happier and healthier at work.
A couple of points. I think what you did mention about the people who were on board, I think, especially during COVID times, we'd quite a bit of comment from people being referred to workday stress that they didn't get a feel for the culture when they were taken on. And I think a lot of companies now are going back and looking and get involved in retraining and reinduction of those, because they never felt part of the organisation.
One of the key things that has come out in this particular survey as well, good mental health and well-being, that's on the rise amongst employees. So that's on the good side of the column, but on the negative side of the column, poor and very poor mental health has seen an incremental increase from 5% to 8%. And John, I know we talked about the wider issues that might be impacting people, but that's worrying, isn't it? That you've more people in greater distress.
In the workplace, you do. Now, I suppose, in general terms, you see, if you look at those figures I came from, okay, so you've got anxiety. We know that, in particular females, you're twice as likely to have anxiety between the ages of puberty and 50, okay? When it comes to the workplace, I think that if I was going to say, I'll pick it up in three things that we've been talking about, okay? First of all, if you just go on prevention and the preventive paradigms, you'll be partially successful. So you have to do more than that, Sinead. Connected health, which we talk about. So prevention will work for occupational illnesses in terms of looking at the hazards, etc. But so much of what you see now in terms of mental health is not just due to that. It's due, okay, but mental health hazards at home and mental hazards at work. But there's an interface now as well in terms of what people are struggling with. That interface between the work from home, work in the office, and the whole work-life balance piece,
Yeah.
which is new and which has really come to the fore more since COVID. And I think that's certainly adding to the stress, Jonathan.
Sinead,
Yeah.
on that point, that was, that's the old school approach, but that was your problem. That's not my fault that you're feeling this way, and where are the returns, where are the numbers, where's the output, where's the whatever. You can't get away with that anymore. And it's not that the law is saying that, it's the workforce is changing, and you need to respond to it in a different way.
And you have a duty of care.
And you have a duty
You
of
have
care.
Jennifer Cashman's going to talk to this absolutely from an employment law perspective. You have a duty of care. You have people working for you, not computers.
Yeah.
If you look after them, they will look after your business. It's that simple. It's really difficult to do that because they all value something different. Going back to John's point, EAP is an amazing service. Yeah, I think everybody probably has it now. It's become quite democratized, which is it's a good thing.
When it was first introduced, it was the Irish have a very unique way of looking at these things. Going, I will, but now it's a much more comprehensive thing, and employees do actually use it.
Absolutely.
So it's not. Yeah, maybe Joanne can talk, but it's not just about. You have a problem. It's the complete opposite. It's like you're not sleeping well. What are you worried about? Is it financial? Is it legal? Is it career guidance? Is it relationships? Yeah, it's much more. It's much broad. It's more around lifestyle issues.
Joanne?
I think that's really true. I think this is it about practical, bespoke, whole range of different supports that are available, and obviously we're promoting the EAP constantly because it's such a fantastic service, and what we really need is people to come out and talk about their positive experiences of it as well and how much it's helped them. But, it does come back down to stigma a little bit as well. But I think as well, EAP and our mental health first aiders and our occupational health are these great supports from a kind of a reactive way as well. And I think we need to be proactive when you talk about risk assessments and things like that. That's what we're trying to get to now. Bank of Ireland is around looking at what kind of environment are we setting up here? Is it contributing to positive health or negative health in terms of workload, role clarity, looking at the job person fit and so on?
Almost 20% of women and 12% of men report feeling anxious all the time. Now, that is a really worrying statistic because whatever about being anxious from time to time, being anxious all the time is inevitably going to not just have a massive impact on their lives, but their ability to do their job. And that is something that you need to support, particularly women. Why are women more anxious than men?
This you probably ask for John, but I'm trying to clarify. It's not women. Women are not the problem. I think Joanne, you talk about the systems, right? I think the systems process how you design different HR practices to promote or prevent and promote well-being, and also the leadership. I think during our chat, there's a lot of causes for stress, for anxiety, and a big part is conflict and environment, job overload. I think it is how design the job and the practice or the working environment fit for a purpose. That's probably very important to address.
Joanne, on that point, why do you think women are more anxious than men?
Again, I completely agree in terms of how it's set up as a system is not designed for women. And now we're getting there, but it's all very late in the day and it's difficult to be heard, and I think there's just a lot of barriers for women.
But I think it's important, just going back to the earlier point, that women suffer from more mental health issues than men, regardless of the work. That's the reality. And suffer from combinations of mental health problems more than men do.
There is a generational shift, though, John. Young people are coming through. They're now taking on positions of management. So the attitudes that they would have had that would have been almost outliers 20 years ago are becoming more mainstream now. There are still some dinosaur policies, some patriarchal policies that are out there. Yeah. How do we get rid of them? How do we make sure that those who are still enforcing them realise that you're going to lose your staff? You're actually going to damage your company. You're not going to succeed in what you're trying to do if you keep going that way.
I think if you look at that, Jonathan, notwithstanding the fact that there is more mental health in females than males, there's more pressures on females in the workforce and different types of pressures, no doubt about it, that males don't experience. I think that certainly creates an impact. In terms of what you can do, I think three things, takeaway. Prevent promote and provide. Okay, so prevention we spoke about, the risk assessment that you mentioned, which is key, and it's not avoidable. I mean, that's not optional, because you've got to do that from a health and safety perspective. You've got to do your prevention risk assessment. Promotion of mental health in the workplace is the next piece, key, not optional anymore. Because when you think about it, I mentioned that 2/3 of the mental health problems that we see are mental health, anxiety, depression. Okay, that's contributing to presenteeism, people at work who perhaps are not performing as well as they might do, etc. Think about the impact you can make, and some put a figure of 3.5 times the impact on that group compared to the impact you make in absence. Okay, so you can probably make more of an impact by getting involved in the whole mental health promotion side of things in the workplace on people who are bringing mental health into the workplace than you are just by focusing on narrow risk assessments. So it's not one or the other. Prevention, health promotion, and provide supports, the third part of it. And it's a combination, and that's connected health.
One of the things we're going to hear from Brian a little bit later on is substance abuse and the change that employers have been reporting in the last 12 months. It's quite startling, a doubling of the number of employees struggling with substance abuse as an effect of anxiety, gone from 7 to 14%. And that's almost a red light level of warning.
It's definitely a red light. We see this coming through too much in occupational health, to be honest. It's the issues are becoming more complex, right? So we talked about EAP earlier. I just wanted to finish that point, right? It is a brilliant service. But it's for kind of everyday issues that are not really health issues. And we've Emelina Ellis here, who leads up our clinical program for that. It's amazing. But when you have somebody who's dealing with intense anxieties, Brian Penny's going to talk to this later, TED Talks. I can't wait to hear, because I haven't heard the story yet. But that's serious. That's really, really serious mental health issues. You need a medic, you need a psychiatrist, you need a psychologist there. Managers are not trained to know these signals and these triggers. So how do we train?
How do we work it? I mean, look, and again, without going into specifics of policies where you are, Joanne, but it's a difficult thing. I mean, what does an employer do? I mean, traditionally, you bang the table and you go down with that sort of thing. If we catch you, you're gone out the door. But, you know, for all the reasons we've talked about, that's not necessarily the right approach, is it?
It's very complex, and I think we need to work with OC Health on this and understand how realistic we can be about what getting someone back to work and what that looks like and how we can support them in reintegrating and so on. But it's definitely something that we've seen a stark increase in as well.
I mean, away from the law around this, which is clear in many ways, you know, there is that phrase we talked about earlier that Jennifer referenced, duty of care.
Yeah.
It is a huge factor, John, isn't it?
Yeah, it is. It is. And I mean, no matter what you do when it comes to mental health in the workplace, including substance abuse disorders and indeed alcohol, you can't get beyond that. But you can get involved with the others, which become more individualised as you go on. So we get to support is quite individual, but you can't get away from the group measures. That prevention. That's where it all. That's where it all begins. But training managers actually has been sure to make a big impact in terms of mental health in the workplace, and especially on reducing absence. You know,
I think there's another bit for me which I start to see coming through, not in OC Health, but more in leadership, and that is addiction, but it's crazy high performance addiction. Like, we have to meet our targets at any cost. We got like. It's not an infinite mindset. It's we got to get this done and we got to get it done in a month. And it's like, we don't have the resources. We don't have the team. And it's like, and you're out doing your triathlons at the weekend and you're kind of, and you got to cycle all to keep yourself, to have the energy to keep, but you're not bringing anybody with you. You're not, it's all about you. It's that kind of ego, and it's a huge addiction. And that's also something we don't talk about.
But is it because our definition of addiction is so narrow? I mean, it is... Like, if you think of an addict, you think of somebody who's addicted to a psychotropic substance of some kind, but it's not necessarily that on its own. It can be multi-layered.
Emelina talks about these maladaptive behaviours, and we, you know, it's like, it's kind of easier to say, well, look, you know, they're hitting they're drinking or they're taking drugs. it's kind of accepted that you want to run a triathlon, or you don't run it, you cycle it.
Can
so
I just
don't know
point
what,
out,
I won't be doing
absolutely
it.
not accepted by me that you're running a triathlon. That's the last thing on my list.
And that's not the point. It's just more that extremism. It's easier to talk about extremism when it's something that we say, God, that's really bad. But there's other extremisms that are quite
I'm not going
accepted.
to fall into that category, because when I was thinking of here this morning, the hotel I was staying was very close, but these shoes are new and I didn't want to walk because it hurt my feet. So therefore, I am not in that list of people who are addicted to triathlons. You'd be delighted to hear. One of the key takeaways from this particular report is that the stigma around mental health is being reduced. And I have to say, that is the best takeaway that I can find in this particular report. Now, we cannot have enough of that, sure we can.
Oh, definitely. I think it's providing a safe environment, not physically but psychologically safe in the teams, in the organizations, for people to speak up. And then, when people speak up and you take, okay, how can I help you, rather than what's wrong with you? That kind of a mentality, I think, is on the, towards the better direction.
Joanne, how much of that is down to the changing nature of the workforce? This idea that the workforce, that they're younger, they don't tolerate as much as perhaps I would have done when I would have started in a workplace. As a result, everybody's learning from that.
Absolutely, and that's brilliant, and we're doing a lot of work in this area. I think we've got 5 generations, you'd say, at work now for the first time ever, very different kind of perspectives. But I think, absolutely, I think, we've come so far, but then I hear the odd comment and I'm like, oh gosh, are we still there? Is that really what we're thinking? So we just need to keep on, and I think senior leaders have a massive part to play in that, in terms of showing that you can be very, very successful and still need help from time to time. And it's normalising reaching out for help. So I still think we have a long way to go. But
John, to say that mental stigma has been removed, of course, is nonsense. It's still there, but it's about the supports and the policies that are in place. So how do we go about making sure that the right supports and the right policies, the people who are watching right now, who think, well, we're doing well, but we'd like to do better. What do they need to do?
I think if you can think about along the lines of prevent, provide, support, a very simple, keep it simple, 3 things: prevent, provide, support. Prevention is about your risk assessment. You'll all have health and safety professionals helping you with that piece. The promotion piece in the centre, culture. You've got to work on the culture and breaking down the barriers, breaking down the stigma, talking about it, awareness, communication. Without that, you're going to find it very difficult. And then providing support, EAP. But joining them all together, I think, is key here, Jonathan, that you don't have prevention happening over there, you've got some promotion going on over there, and you've got an EAP service which doesn't connect it at all. You've got to pull them together and really drive this as a mental health strategy.
If they operate in isolation, they don't succeed.
They'd be less effective.
Sinead, about 2 minutes left, if we can, just to finish up with yourself, if we can. Those supports and policies, I love the idea stigma has been reduced. That's fantastic. Huge levels of anxiety, that's a worry. Substance abuse, that's a worry. Women feeling that somehow, because of who they are, they're going to be disadvantaged. That's a worry. I mean, we always like to think of the glass half full, but there's still many. Yeah, there you go. We still have, thank you for bringing your own prop from home. We still have these big mountains to climb.
Yeah, we do.
And that's what today is about, isn't it?
Yeah.
About, pointing the direction towards those mountains.
Sumi and I talked about this, right, while we were having photos taken, and it's a huge mountain to climb, but we have to climb it, and we're at the tip now. So the hardest bit is getting to the top. I think we're there now, so it's downhill. So let's go for it, and just keep on talking about it, having the conversation, sharing best practice, putting it into practice, doing the research. Does it work? Experiment. Let's try it.
Yeah.
We've nothing to lose.
Yeah.
We've everything to gain.
And there is a wealth of information and a wealth of knowledge that is out there right now. So, why aren't you using more of what NA has produced? Why aren't you listening to the likes of John, the experience of Joanne? All of that will make you a better employer, won't it?
Yeah, and that's what we want at Laya Healthcare. We want people to be healthier, because you know what? It's better for your business, and it's better for our business too. Funnily enough, let's do it, so yeah.
We have some brilliant advice coming up on the rest of our panels throughout the day. So make sure that you stay with us, or that you watch them, or you check them out later on if you can. But for now, can we have a huge show of thanks for our panel? Sinead Proos, Joanne Healy, Dr. John Gallagher, and Professor Na Fu, ladies and gentlemen. Thanks very much.